Hi, my name is Michael Fulgham, and I'm going to show you today how to draw blood. It's a very easy thing that I do every day at my work. We have to go by different tubes in certain orders for different tests. I have my patient here, and whenever I get my patient, I always ask for two identifications. I ask for their name
Amber Umstead,
and their birth date.
3/20/72.
And I always usually have stickers that have their information on it and which test to draw. I have to always have my hub, a needle, cotton, and an alcohol bag. Along with make sure my Coban is here beside me and have a tourniquet. Always have to make sure my hands are clean between every patient, before I put on gloves, after I put on gloves. Now I just extend the patient's arm out, and I tie the tourniquet, not too tight, but just a little tight, where they'll make the veins pop out more down in the elbow region. And as you can see on Amber's arm, you can see there is a vein here, here, and here. Usually you can see them, but if you can't, you can always just put your finger down and pulsate. And what you'll feel is a little bounciness. That's when you know that you found a vein. Right there seems to be a really good one. So I'll take my alcohol, do it in a clockwise motion to clean it. I take one end of the needle that I insert in my hub, and my tube will go in here and will puncture through that needle that is covered by rubber whenever to pull the blood out of Amber's arm. We're going to do 3 tubes. These tubes are mostly what I use them for is this one for like a thyroid test, a simple metabolic panel, and a CBC, which is a complete blood count. So I take it off, make sure my safety is down, make sure that the bevel right there at the end is pointing up, and then I just guide my needle into the vein. And you have to go in gold, green, and purple order. Untie the tourniquet as soon as there is blood flow inside the tube that you can see. Once you get enough blood inside the tube, you switch them out. You do not move this hand, and you do not move the needle anywhere. Sometimes you have to ask the patient if they're okay, if they're feeling okay, especially because sometimes they start sweating and get ready to pass out. And if that happens, whenever you're done, you turn the fan on, go get some orange juice and some crackers for them. Okay, when you're done, you invert them 3 times at least. Take your cotton and just don't push down, but have it just cover where the hole is in the arm. Gently pull the needle out, apply pressure, put your safety onto your needle, set that down, grab your Coban, pull some of it off, and wrap it tight but not too tight where it cuts off the circulation to their arm. And then I would label my tubes with my initials and the time that I've drawn. And then I ask if my patient is feeling okay. If they say yes, then they are free to go. I tell them thank you, have a great day. And that's how you draw blood.